Good good afternoon, and welcome to the Rhythm Notes of Health with me, Kai Ayenta. I am so excited. We finally got through that men series, and um, we finally got through that men series, and that ladies series, and now we're ready for the men series. And if I can just get my music together. And I'm so excited that we're going to start our men's prostate health and sex series out with Dr. Melvin Fussell. He's going to be talking about prostate health. I'm so excited about this series and all the things that we're going to be talking about. But without further ado, let me bring in Dr. Melvin Fussell. I'm going to let him tell you about himself. He is TU. We went to school together. So let me just bring him in and get this thing started. Dr. Fussell.
Hello.
How are you today?
Excellent. Doing well. Doing well.
I am so excited. I was just telling the guests that I am so excited about having you on here because not only are you smart, but we have Booker T in common. We both went and graduated from Tuskegee. And
Right.
so TU.
You know.
Absolutely. Hey, when I see people and they have on a t-shirt and I say that and they don't say, I'm like, what? You're not Booker T for real. Like everybody knows that, even though that wasn't what it was when we were there, right? That's some new generational stuff.
I know,
we just tacked on to it. I know, me too. I love it too. We needed a call. But today we're here bringing the Booker T Smart with you to talk about our men's series. We just finished our vaginal health and sex series of our women's.
Wow,
It went really well, probably better than what I expected. So of course the men are like, when is my turn? I was like, no worries, your turn is coming. So we're doing a prostate health and sex series for men. And we're going to start the series off by just talking about the prostate. But before we get started, Dr. Fussell, tell us who you are and what you do and where you're located.
Okay, I'm a board certified urologist. I'm in Warner Robins, Georgia, which is really just south of Atlanta, middle Georgia. I have a lot of people that travel to come and see us. The thing but I consider myself kind of a mixed background. I'm an electrical engineer, I'm a bioengineer, doctor, and a surgeon. I've kind of bounced around and consider myself a bent arrow because I went from Tuskegee, Fort Valley State, University of Washington, University of Wisconsin, University of Georgia.
Wow.
I was the second in the history of their program in general surgery, first in urology. So I've kind of bounced around and now I'm doing my thing.
Yeah, and that's why you're so smart, because you have gotten experiences in a lot of different areas, and right, so you're able to take everything that you've learned in each area and bring it to make the whole you, right? So so you're in Macon, Georgia. Is that Warner Robins?
Warner Robins, which is adjacent to Macon.
Which is adjacent, and that's not far from Atlanta. Right. So if you're in the Atlanta area, we expect for you, because here's the thing, we always say, you and I have talked about this, you pay for what you want, right? And if you want to have the best in the best, and in Blackpink, we only deal with the best in the best, right? Because we only refer with the best in the best, then you have to be willing to drive. So thank you, Dr. Fussell. It was like, a lot to get you here, so let's just get on with it because I know my time is winding down. Let's just start. Let's just start by talking about the prostate and what is the prostate?
Okay, the prostate is an organ that's located below the bladder, and basically the prostate has a function. It produces the fluid that the sperm floats in during ejaculation. Now, the thing is that a guy can live without his prostate, but the prostate causes some problems sometimes. Because I'm a GU surgeon, a general urinary surgeon, I always explain to my patients when we talk about anatomy, I say, you got two kidneys that filter blood and make urine. Urine comes down these tubes called ureters, fills up in the bladder. When you urinate, it goes through the prostate and out. So then when you focus on the bladder, I said, think about the bladder like a balloon. You squeeze a balloon, the water shoots out the pipe. The pipe is out through the penis. But when you go through that pipe, it goes through the prostate and out. Now that becomes a problem. So that leads to all the things that happen with the prostate as far as urination and things like that.
So, so you said that the prostate is below the bladder, right?
Correct.
And hence is why I guess maybe older men, they go to the bathroom a lot. Does it have something to do with the prostate?
Yeah. So
okay, we're gonna get to that. We're gonna get to it.
Okay.
We're gonna get to it. No worries, no worries, no worries. No worries, we're gonna get to it. No worries, we're
Okay.
gonna get to it. So let's just talk about the anatomy of it. So it is below the bladder, because Dr. Fussell, to be perfectly honest, although we'll have men to listen and see the podcast, the majority of the information is going to come through their wives or spouses or significant others, right? Because we're the people that's going to push the men to go to the doctor, get things checked out, and we're the people that pay attention to what's going on the most, right? So we just want to make sure that the men understand the prostate, because there's a lot of men, they know the prostate, but they don't really understand, right? And then we want to make sure that the women are understanding exactly the function of the prostate. So you said that it is below the bladder, right? Correct.
Right.
And you use a balloon as an example, right? Now, does the balloon represent the prostate?
The balloon represents the bladder.
The bladder. Okay.
So the balloon fills up and it stretches. It sends a signal to the brain that, hey, I have to pee. And you send a signal back down. Okay, relax the sphincter, squeeze, and you can urinate out. Now the problem becomes is that when the balloon squeezes, the bladder squeezes, it shoots the water out the pipe. Think about the pipe like the penis or the urethra, all right? But when it goes through that pipe, it has to pass through the prostate and go out. The problem becomes as the prostate gets bigger, it becomes more obstructive, and now the pipe is obstructed. Now you have peeing problems.
Okay, now you have peeing. Okay, but you also said that you can live without your prostate, right?
Correct.
How is it that you can live without the prostate? As we talk about the anatomy and what the prostate is, how can you live without it?
Well, the prostate is basically producing the fluid that the sperm floats in. So the thing is that if a guy has prostate cancer or whatever, we can actually go in and remove the prostate, and then you reconnect the urethra or the ping channel directly to the bladder, and now you go forward without the prostate.
Okay, but you said that the prostate is the only function of the prostate to carry out the fluid, or is there another function of the prostate?
Well, basically that's the major function, because when a guy actually ejaculates, the sperm comes from the testicle.
Okay.
All right, but the fluid comes from the seminal vesicles and the prostate. So I always explain it to my patients is that it's like 1 + 1 = 2. 1 part sperm, 1 part fluid, and then you ejaculate out. Number 2 is the semen. So the thing is, just like if a guy gets a vasectomy, where we actually cut the vas deferens, now the sperm can't get through, but they still ejaculate. The fluid is just coming from the prostate in the seminal vesicle.
So I like that you said 1 part sperm, because that makes it really clear, right? 1 part sperm, 1 part fluid, right? And the part that's fluid is coming from the prostate, correct?
Correct.
Okay, so the part that's so if you didn't have the prostate, then can you still be able to produce a baby with someone?
No, not directly as far as ejaculation, because you won't have that fluid. You can do other things where you get sperm directly from the testicles. But the thing is that once the prostate's removed, the guy's not ejaculating anymore.
Okay, so the fluid is then. It is safe to say that the fluid is important to work with the sperm to be able to now give this make a baby, if you will, right?
That's the semen. So you won't.
Okay, that's the semen.
So I always say 1 + 1 = 2. 1 part sperm, 1 part fluid equals semen. So the thing is that you got to have the testicles that make the sperm, and the fluid comes from the seminal vesicles and the prostate. So those two together, now you get semen. So if a guy removes his prostate, he can still have sperm, but it's not getting out because the prostate's now gone.
Okay, great. Okay, so then the next question becomes, as we understand the graphics of what it is and visualize, right? Why is the prostate important to men? Why is it important? Is it an organ? Is it an organ?
It's a reproductive
A
organ.
reproductive organ. Okay, very good. I like that. So why is it, well, that kind of tells it, but we're going to say it anyway. Why is it important to men?
Well, the thing is that, you know, it's important from the standpoint of reproduction. It also, wait, because of the anatomy, when the urine comes from the bladder, it goes through the prostate and then out the urethra. You know, there are sphincters that are there. So the prostate plays a part as far as controlling urine and things of that sort. So say if a guy had his prostate removed, right? One of the things that can happen once the prostate is removed, you can destroy a sphincter and now the guy can be incontinent, losing urine, things of that sort. You know, so it plays those type of functions.
And the sphincter is the muscle that helps you control to urinate or not, because we talked about that in some of our women's series, right? That's what the sphincter muscle is also in male, correct?
Right. There's a smooth muscle and there's an external muscle that's controlled directly by the guy himself. So like when you're trying to hold your muscle, you hold your urine in, that's a voluntary muscle. So just think about a sphincter as something that closes up and it opens, closes up and it opens.
Okay. Okay. And so do men, because when we were talking about the women's series, when they talked about the sphincter, right, they talked about doing exercises and doing things to tighten up the sphincter. So as you know, incontinence happens in women as they get older and lose hormones and those things, right? Is that the same, not so much with the hormones, but it's the same effect with men? Can they do exercise to tighten their sphincter or not, or their anatomy is not made in that way?
Well, actually, they can. The thing about it is that you have to think about the pelvis. The pelvis has a pelvic floor, which is made of a series of muscles. All right. So you got these muscles down there, and once everything gets stretched out, saying doing a woman having a baby or something like that, then other things can happen because she's got laxity in her pelvic floor. So she'll see things like, oh, my bladder dropped. Or, you know, they get a rectocele where the rectum's pushing out or the bladder's pushing out because of all the pelvic laxity. And they can, and then they start having problems with the sphincter control, things of that sort. You know, for a guy, usually when you start having problems with leakage, it's usually because of surgery, you know, because you've had, you know, his prostate removed or stuff like that. Plus, guys have two sphincters. You know, we have the smooth muscle sphincter, and then you have the voluntary control sphincter.
Oh, okay. So they have two sphincters. Okay. Okay.
Yeah.
No. That's good to know in understanding the male anatomy, right?
Yeah, that's why guys don't leak as much as females. Usually when you start talking about urinary incontinence, a female only has one sphincter and she has a very short urethra. A guy has two sphincters and a much longer urethra because it goes through the penis. So guys have, number one, they have less urinary tract infections because it's a longer urethra to get back into the bladder for infection. And we have two sphincters that keep us from leaking.
Look at that. You guys, listen, you know, we're not gonna get into all that, but the women, we just have to go through so much as females. It seems like you guys just have the easy life, even when it comes to reproduction, right? You have one role. You know, recently I was teaching a STEM class and the students, and we were talking about the making of honey, and the male bees had one role. It was reproduction, and then they die off, right? And the guys in the class were like, well, that's horrible. That's all they do. But I said, but that's a very important role, because if they weren't able to reproduce, then the bees couldn't continue to have more bees and make honey, right? So I had to twist it so they could understand, because it was like, that's all they do.
Well, they do protect the queen.
No, they not. The queen has the queen actually has a cord almost that protect her. She has guard bees. Now I had to learn all that in the summer where I wasn't supposed to be teaching, but I'm teaching a STEM class, right? Okay. So I learned all that, and it was like, oh wow, but I just had to give those guys some hope to but it does do this. So they only have that role to reproduce, and then they're gone. So even their cord of protection is, but I digress. Let me get back, because we don't have much time. So
that was interesting.
Yeah, so let's just get back to this. I just love science. So any way I can get people to understand science where they can empower themselves, and you got to start early. That's literally, although I cannot be a school teacher, right? That's literally what I like doing, and hence is why I like doing the podcast and partnering with physicians like yourselves, just so we can educate, right? So as we talk about the prostate, right, in this men's health series, what hormone, is there a hormone, right, that affects the prostate? And if so, what hormone is this?
It's testosterone.
Okay.
And the thing about it is that, just like women have estrogen, men have testosterone.
Mm-hmm.
And the testosterone causes the prostate to grow. All
Okay.
right. And it gets bigger over time. That
Okay.
gets into a lot of other things, what we talk about as far as, the size of the prostate, obstructive problems, things like that, or even
Mm-hmm.
prostate cancer.
Mm-hmm.
So yes, testosterone is that hormone.
Okay. So as men age, so when they are, so because the next question is the age in the men's prostate, right? And so you kind of segued into that. So as men age, so what size? So I read that the prostate kind of is the size of a walnut, correct?
Correct.
So it doesn't start at that size, right? That's like the normal average size at what age?
Usually around about age 30, 40, a guy's prostate is full size. It's about
Mm-hmm.
20 grams, or the size of a prostate.
Mm-hmm.
But from the influence of testosterone, that prostate gets bigger and bigger and bigger. I have
Mm-hmm.
guys that come in where they cannot urinate. Remember the picture that I was trying to paint when I talked about the balloon squeezes?
Mm-hmm.
Urine goes through the prostate and out. Now, if
Mm-hmm.
it's a 20-gram prostate, the water can go right through the 20-gram prostate. But
Mm-hmm.
a guy comes in with 150 gram, 200
Mm-hmm.
gram prostate.
Mm-hmm.
Now he's trying to pee through a grapefruit.
Mm-hmm.
And it just can't get his water
I
through.
I was just going to say, when you speak of these grams, what do you mean in size of visualization that is understandable? So you just said it like the size of a grapefruit would be like, how many grams would that be?
Ooh, that could be, maybe like 200 or
200.
something like
Uh-huh.
that's a very large prostate.
Uh-huh.
But I often see guys with prostates around about 100 or so.
100
And
or so. And at what age is it around 100 or so? Is there like an
well,
average age?
everybody's different, and
Mm-hmm.
depending on their testosterone and the influence on the prostate and how their prostate grows. But
Mm-hmm.
the problem becomes, as it gets bigger, it can also become more obstructive, and
Mm-hmm.
that's when the problems come in.
Mm-hmm. So when men are in their so Dr. Foster, so when men are like young, and they say that that's when their sex drive is the highest, right? Does this have anything to do with their prostate? Does it have to do with their maximization of the testosterone? Like, so I'm asking you that because I'm trying to make the relationship of the prostate and see, is it related? Is it related to their sex in their mind and why they have this peak at this age? You understand what I'm saying?
Yes, and the thing is that testosterone is produced in the testicles. All right,
Mm-hmm.
so
Mm-hmm.
that's where the testosterone is produced. You got different types of cells, Leydig cells, Sertoli cells, and what happens is that there is and I don't want to get too deep on this, but
Yeah. Uh-huh.
basically there is an axis between the brain and the testicles that say, hey, make more testosterone. The anterior pituitary gland is releasing hormones that go down here and say, hey, make more testosterone. It's floating in your body and say, oh, slow it down, speed it up. But then what happens over time is the guy stops making so much testosterone from his testicles, and then things start to drop off. And
Mm-hmm.
that's when the problems have happen, when their sex drive starts to fall off.
Mm. So listen, I literally was in Detroit a couple of weeks ago, right? And I was talking to we met up with some Tuskegee folks, right, to hang out while I was there, and I was telling them that I was doing the men series in the podcast, and we literally started talking about the testosterone and these things. And one of the guys told me, and so because of course these are guys around my age, so it's 50s to 60s in that age group, right? So the guy started talking about his testosterone levels and his sex drive, right? And one of the things that he said is that his what he realized, he was dating this particular female, and it was after a divorce, right? And he said, and what he realized is that he was having a hard time, although he felt in his mind he wanted to have the sex, right? He wasn't able to really have the sex with her. And he was having this conversation as I didn't know if it was her, I didn't know it was my mental, but we were talking about how connected your mental is, right, to your sex drive, which now you're saying the prostate and how it connects and sends out these signals to say produce, right? So your mental, right, then are you saying, Dr. Fussell, that your mental then can control this, how much testosterone is released and or not released, or is it just the universe and the aging and how it happens? You understand what I'm saying?
I think so. But let me just break it
Okay.
down like this.
Okay.
The thing about it
Okay.
is that you got this male hormone, testosterone, that's coming from the testicles.
Uh-huh.
Now, testosterone is what gives us muscles, it gives us male pattern hair growth as far as beard and mustache and all this other kind of stuff, and it makes certain organs grow, the
Mm-hmm.
penis, the prostate, things of that sort. So you
Mm-hmm.
got this hormone that makes you a man. Now, once that
Mm-hmm.
hormone starts to drop off, it's like your body fights against it.
Mm-hmm.
Just like a woman goes through menopause, a guy can
Mm-hmm.
have hot flashes,
Mm-hmm.
irritability, weight
Mm-hmm.
gain, things of
Mm-hmm.
that sort. So, he starts to notice usually when guys come in and their testosterone level is dropping, they
Mm-hmm.
find that they have problems multitasking. They get
Mm-hmm.
irritated real easy.
Mm-hmm.
Sex drive is gone. At the end of the day, I'm just tired. I used to come
Mm-hmm.
home, I go to the gym, work out. Now all I
Mm-hmm.
want to do is get on the couch. I'm not doing anything outside. I'm just done. Just don't have the energy to do it anymore. Those are the
Mm-hmm.
guys I say, okay, well, let's check your hormone levels.
Mm-hmm. And so if in women we call it menopause, is there a name for it with male?
Hypogonadism.
Hypogonadism. Nobody's saying that. So is you're saying that, Dr. Foster, but nobody
Yeah.
is saying that. So that would be the medical term, right?
Yeah, just think, the
So what would
testicles
be
are
the
the
layman's
gonads.
what would be the layman term? No, but Dr. Foster, nobody is saying that. So what would be the layman term? You know that, right? And I know that because I've heard it, right? But nobody knows that. So is there a layman term that's used when
Or
men
just decreased libido.
decreased libido? So that's why the GYNs, right, also talk about when they talk about men and their testosterone levels, they also talk about shrinkage of the penis, because you just said that the testosterone levels also give length, correct? Is that what you said?
No,
What'd
no,
you say?
it helps out with the growth of organs. Like when
Oh, the
a
growth of
baby
organs.
is in its developmental stage and stuff
Uh-huh.
like that, or a young male is growing, the
Uh-huh.
testosterone influence will affect size of penis,
Mm-hmm.
muscles, hair growth, things of that sort.
So when they start having testosterone depletion, if you will, as they get older, then it has nothing to do with the shrinkage of the penis size.
Usually, when a guy start noticing, I have a lot of guys come in and say, "Man, it just shrunk up."
Mm-hmm.
The thing about it
Mm-hmm.
is that, when you start talking about the penis itself, the
Mm-hmm.
penis is erectile tissue. And I always explain
Mm-hmm.
to them about the penis, kind of like a rubber band. If you
Mm-hmm.
stretch the rubber band out, it stays very elastic, things of that sort. But if you're not
Mm-hmm.
stretching the rubber band out, it gets tight. And
Mm-hmm.
that's basically what's happening is that, a guy gets older, say his
Mm-hmm.
testosterone level is dropped off, he's not
Mm-hmm.
very sexually active. And, now, he's not really using the penis anymore than for voiding,
Yeah.
and it starts to
Yeah.
shrink up. In
Yeah.
addition to that, he may gain some weight,
Uh-huh.
and then, there's extra fat around there. So he looks down, it looks shorter because it's
Uh-huh.
gotten tighter,
Uh-huh.
or it actually shrunk back into all the extra fat.
Uh-huh. So my laughing is my questions in my head as you're talking, right? So Dr. Fossil, so did you just say that men who don't have sex a lot, that ain't what you said, but I'm interpreting, right? Did you just say men who don't have sex a lot then can have shrinkage? Is that what you said?
Basically, I always tell my patients if you don't use it, you lose it.
Is that the truth? Like, oh my
Yeah,
gosh, I'm gonna be
yeah.
telling women, you heard? Did you just hear that, women? So, if one of the therapists said, one of the therapists was on the show is saying that we're gonna do a show about women who withhold sex because of their attitudes, or they're trying to punish their spouse, right? So this is important to know, women, while you're trying to hold out with your spouse, you need to stop trying to hold out, because this can cause some shrinkage. And at the end, you're probably not gonna win. So stop the holding out, right, Dr. Foster?
Yeah.
Because you just said it. That is, oh my God, I'm gonna be telling women this all the time. Say, listen now, I talked to the doctor, and this is what he said. So use it. Listen. It's just like people, because I'm a singer, right? And you can hear the raspiness in my voice because this is from yelling, not singing. But you know, the, the vocalist or the vocal coach always says that if you don't use that muscle right in your vocal cords to sing, you would eventually lose it because you're not. It's the same thing that if you don't use it now. Dr. Foster, this is not good for me and who just be doing something they ain't got no business doing all the time. Because I'm probably helping them on one hand, right? And then on the other hand, it's like bittersweet, right? So the bittersweetness is of it, however you look at it, right? Is that if you don't use it, you're gonna lose it. Now, don't nobody come for me because people will come to me and say, I need to use it on your podcast, blah, 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 blah. I'm telling you what the doctor is saying. I'm repeating it so you can further understand, right? And what I want to stop and say right here, Dr. Fussell, is not only are you a specialty in the prostate, but you also do penile. Now we can just take a moment to talk about that since we're right here at this moment, right? We'll talk about it again later, but like on another show. But I want to take the time to just stop right here and talk about what you do as far as that concerns. So men get older, they not using it, they losing it. How can you help them regain what they had when their youthfulness? Not maybe you can't take them back that far, but how do you help them to regain? Since we're there in that spot, let's just.
Well, I can tell you the thing about it is that, say, usually when a guy comes in and he's having problems, erectile dysfunction, we always talk about, what can you do? I always try to make it real simple for my patients. I say it's kind of like swinging a pendulum across. First thing you start talking about is that I need to get more blood flow. There's three basic things you need to get an erection, right? You need good blood flow, you need good nerves, and you need desire. All right. Now the blood flow
in that order.
Well, it's not necessarily in that order. They all work together. So blood flow issues can come from a lot of different things: hypertension medication, chronic diseases like diabetes, and things like that. All that kind of works together to affect your blood flow. All right. Nerve problems could be from surgery or radiation to the pelvis. Hormonal, that's your desire, that's your testosterone. Now, when a guy gets a good erection, he's hitting on all three channels. He's got good blood flow, he's got good nerves, he's got great desire. So all that works together. Now, you get the guy over here who has erectile dysfunction. What I have to do is kind of approach it from the standpoint of what's going on. A lot of times, guys come in and, we might be talking about apples and oranges when we need to be talking about apples and apples or oranges and oranges. And, so I always have to really focus on what's really going on. Is this a hormonal problem where I can get an erection, but I just don't want to? I don't have any sex drive, or I got all this sex drive I want to, but it's just not getting hard. All right. So now I got to figure out, okay, which one is the problem? What do we need to focus at to figure out what's going on? So most time the guy has desire, so his testosterone is fine, but he just can't get an erection. So now the thing becomes, okay, what's causing it? Is it a blood flow problem or is it a nerve problem? Well, I had never had any radiation or any type of surgery down there. So really it kind of comes down to a blood flow issue. Okay, what other medical problems do you have? Do you have high blood pressure? What medications are you taking? Do you have diabetes or some other kind of, systemic illness that may affect your blood flow? Now once you focus on that, then you say, what are the treatments? Treatments usually fall into, PO medications like a Viagra or Cialis. That's what's most commonly on the market. Or you could talk about vacuum pumps, or you can talk about injection therapy. If all that fails, then finally we're talking about surgery. Now, there are other things that you can do that's outside of mainstream medicine, where you can talk about using things like the P shot or PRP, where you can actually go in here and try to revitalize the penis. So I have guys that come in who are not having good erections. They haven't been that active. I can do the P shot, plasma rich platelets, where, we take your blood, we spin it down, remove the red blood cells, white blood cells, and all we have is your healing factors. And we put that back into the penis and we tell that penis, heal up. And then we go back to what you used to do as a child. And I always say this was something that God gave you. You would wake up every night, or you wake up in the morning with an erection, a hard on, or you get multiple erections throughout the night. A young male, if you got a young boy, he's getting erections all through the night, sometimes even a wet dream. That's all part of these erections that come. Well, that goes back to that rubber band. You're stretching out, it's going down, it's stretching out, it's going down. So it stays very elastic. So when he gets ready to have erection, no problem. I'm used to stretching up. So
Ah.
once I put them on PRP and I say, okay, we're trying to get you to get new blood vessels, rehab that tissue. We're going to use a vacuum pump. I want you to stretch it up several times a day. What I'm trying to do is get more blood flow into that penis. So when you become sexually active, now the penis is ready to stretch up because you're used to stretching it out, because basically you took that rubber band, you put it on the shelf, and all of a sudden you want it to perform. It's too tight. It ain't going to happen. You're not going to get the erection. But that's what we go through when we're trying to rehab a penis.
Yeah.
I know I gave you a lot of
No.
information.
That was good. That was really good. Because because I'm such an outgoing person where people don't know about me, and I'm like a straight nerd. Like I love science, and I said it before. I love to help people to understand science, right? So from what you just said, I'm gonna utilize my knee. I play tennis. I play at Tuskegee, and I play tennis now, right? And so I had to have shoulder surgery from tennis, right? Because it was just like I gotta have surgery. But with the knee has been sprained a bunch of times. The knee been beat up. They say it's arthritis in the knee. However, the therapist like, before you play tennis, because what I would do is stretch, right, before I play tennis, right? But when I finished playing tennis, I didn't stretch again, right? And so she would say, you got to stretch before you play tennis, and then you got to stretch after you play tennis. But what I found is for myself is that I do yoga, right? So when my knee starts to act up, even respond to it about the rain, from the arthritis, I know that, okay, you have not been doing your yoga, like you need to do it right. And so we know that yoga stretches out the muscles, right? And gives us the flexibility to now endure whatever you're about to put on it, right? So I do yoga, when I'm consistently playing tennis, and I don't play it competitively because I just want to be something fun, right? But when I consistently play, I make sure that I do my yoga because that's going to stretch, keep that muscle stretched out and going, right? So basically what you're saying is kind of like the same thing in the whole essence of if you don't use it, you'll lose it. But also you're going to have to make sure that it's a muscle, right? Basically what you're saying, it's a muscle, right? No, it's not a muscle.
No,
but the functionality that you just gave, it's like a muscle, right? So if it's not a muscle, I'm glad I said that so you can explain. So if it's not a muscle, right, then what is it that functions like a muscle?
Well, the thing about it is the penis basically has three channels: the corpus cavernosum and the corpus spongiosum.
That's too much. You got to make that layman, Dr.
All right. So basically, think about these two cylinders, and it's vascular tissue. I always explain it. It's kind of like a sponge. And once you wet that sponge, it basically
expands.
It expands. So you got the sponge over here, and once blood flow comes into it, it expands up, and now it's a hard penis. All right. But the thing about it is that if you get that penis and you're not expanding that sponge, now that sponge is tight and hard. Think about it like that.
But it's not a muscle.
No, it's not really a muscle.
Do people think that? Do people think that the penis is a muscle? No.
Yeah.
They do.
Penis thinks it's a muscle.
So penis thinks it's a muscle, right? But you're saying technically it is, but it functions like a muscle somewhat.
It's erectile tissue, yeah.
It's erectile tissue. Okay.
Yeah.
Okay, Dr. Fussell. Okay, it's erectile tissue. Okay. So for layman people, is that what they would say too, is erectile tissue?
No, they're not going to use.
You got to get it. Hey, Dr. Fussell. So Dr. Fussell, you have got to, like, here's the thing, because you're so smart, right? But you've got to think in this process of people who have no clue, right? Because that's really my audience. They have no clue, like none. They'll email me, they'll call me, and it's like, oh my gosh, like I learned this, I learned that. So I try to make it real layman for people. But in some instances, you just need to know the medical term, right? Like, some instances, like it is what it is, you need no, but if there are terms to help them to understand, because the understanding of layman, and then they'll remember better if it is layman, right? And that's why I ask you. So it's not a tissue, not a tissue. It's not a muscle, right? It's a tissue, basically. It thinks it's a muscle, and it functions in the way that a muscle functions, right? And if you start telling people that it's not a muscle, then they're going to internalize it. And then you're really going to have a lot of patience, because it'll be like, oh, it's not a muscle. How do I get it to work right? But you're saying that your brain works with it together to now get these fluids that it needs to function and act like a muscle, but it's not a muscle in that way, right?
So think about the tissue more like when I gave that sponge, you
Uh-huh.
know, because I'm a surgeon, all
Uh-huh.
right. And unfortunately, you have like cancer cases where you have to
Mm-hmm.
remove the penis or something
Mm-hmm.
like that. If you
Mm-hmm.
cut the penis in half, that the tissue itself looks like spongy tissue.
Ah,
It
okay,
actually
come on.
looks
That's
like
really
a
good.
sponge.
Okay.
All
Mm-hmm.
right. So the thing about it, what makes you think like a muscle is because it expands and it
Mm-hmm.
contracts. But
Mm-hmm.
what it
Mm-hmm.
really is, it spans up like a sponge that's full of water or blood.
Mm-hmm.
That's erection,
Mm-hmm.
and it
Mm-hmm.
contracts back down when the blood goes back out. So
Okay,
think about it
okay.
like that.
Thank you. That's it. That's it. That's it. That was perfect. Dr. Fossil, that was perfect. Okay, so Dr. Fossil, so let's just talk about, because see, I told you earlier that we're not going to be talking about BPH. We're going to talk about cancer. And you're like, well, how do we do that and not talk about that? You see how we do that, because it's so much for understanding, right, that we have to talk about to make sure that people are clear exactly what the prostate is, the function of the prostate with the penis and the male and the hormones before we even get to those dysfunctions of it, right? And so that's why I said we'll talk about that in detail later, because I knew that it was going to take these questions to help people, even for people to understand what actually is a prostate, right? So, but we can, though, in this podcast, talk about screenings for your prostate screenings, like what age do they start, and what screening needs to be done, because I know there's like a few out there, which ones are important to do and which ones are not, and which one do you prefer, right? So first, the question is, at what age?
Well, the thing about it is that, there's been some changes over time with what's suggested as far as prostate cancer screening,
Mm-hmm.
because I've been a urologist for over 20 years,
Mm-hmm.
and I've diagnosed thousands of cases of prostate cancer. I
Mm-hmm.
still believe in screening starting at age 50. Now, here's the catch.
Mm-hmm.
If you have prostate cancer in your family, that means
Mm-hmm.
it's hereditary, it has a hereditary component.
Mm-hmm.
So those guys should start screening earlier, maybe
Mm-hmm.
around age 30, 35. They should get a PSA done.
Mm-hmm.
Normal PSA is less than 4, 1, 2, 3, 4. All right. If
Ah,
you see that
uh-huh.
your PSA is already over 3 at age
Mm-hmm.
35, you need to be watched closely,
Mm-hmm.
because that's usually
So you
higher
said
than
a normal PSA is less than 4, correct?
correct.
Okay. And then you said that if it's at 3, at what age?
Age 35.
35. Uh-huh.
Then you're somebody that needs to be watched on a regular basis. So,
Okay.
you or maybe even consider early biopsy.
Early
When
biopsy.
we start talking about, looking for prostate cancer. But the
Mm-hmm.
thing about it is that, basically now after age 50, every
Mm-hmm.
guy should get a PSA once a year,
Mm-hmm. So
annual
how would a
PSA.
guy at 35 know that his PSA levels are at a 3? Do they just normally check that in physicals, or no? Or do it have to be requested if it's family history?
Well, this is the way I usually approach it in my clinic. I have a gentleman that comes in and I just diagnose him with prostate cancer.
Mm-hmm.
As we're sitting there discussing, usually with he and his wife, or a significant other, I say, if you have any male children
Mm-hmm.
or other males, first degree relatives,
Mm-hmm.
you should let them know that you have prostate cancer and they should get screened early. All
Mm-hmm.
right. So those guys go in and they start getting their PSA checked. So say my dad had prostate cancer, I got checked at age 35. My PSA was, around about 1.
Mm-hmm. Mm-hmm.
Okay, that's fine at age
Mm-hmm.
35.
Mm-hmm.
So maybe I'll check it again at age 40 and age
Mm-hmm.
45 and see if it's going up and watch it closely like that. But
Mm-hmm.
once I get to age 50, I need to get checked every year
Every year.
because I
Okay.
know it runs in my family.
Understood. So even if because in breast cancer, right, the doctors say that when women get breast cancers in their 70s or above, right, they don't necessarily look at that as hereditary, right? They don't look at it as is genetics, right? Is that the same for men, or because the reason I'm asking, because my dad had prostate cancer in his 80s, right? So should now my brothers be getting checked early? They should. Even in the
Yes.
80s. Okay, okay, okay,
Yes.
okay. That's great. That's great to know. So if your father, and you know, I don't know if you know, but I did breast cancer research. That's how I got in this whole public health thing, right? In grad school, in my master's in biology and chemistry, I did breast cancer research, and we actually found that it was with vitamin D, right? And how the cells respond to vitamin D with the cancer cells, right? But also in that research, we also found that there was a relationship between men in the family who had prostate and women who then had breast cancer, or vice versa. So now, now there's more information out. That was a while back. Now there's more information out. Doctors are now telling patients that if your father had prostate cancer, then start your screenings a little earlier, and vice versa. Do you agree with that assessment, Dr.
Most
Fussell?
definitely. Yeah. Yeah.
Absolutely.
They should
Okay.
definitely be screener. And that's what I was saying earlier, that once I diagnose a patient with prostate cancer, I'll mention, do you have, a son or, any first degree relatives
Mm-hmm.
that are males? They
Mm-hmm.
should start getting checked early.
Mm-hmm. And by first degree, you mean like mom, dad, sister, brother, right?
Yeah.
Okay,
Or
very good.
like my nephew.
Like your nephew. Okay.
Yeah,
So nephew would be considered first degree because that's your sister's child or brother's child.
exactly.
Okay,
Yeah.
understood. Okay. Okay. And so what screening should they be getting? You spoke about the PSA, which is, what is a PSA called?
Prostatic specific antigen. All
Okay.
right.
Mm-hmm.
So the thing about it is that this whole thing with PSA, when we start
Mm-hmm.
talking about PSA, prostatic specific antigen,
Mm-hmm.
that guy comes in and his PSA is high. There are other things
Mm-hmm.
that can cause your PSA to be high. All
Mm-hmm.
right. Infection, a big
Mm-hmm.
prostate, or prostate cancer.
Mm-hmm.
So once a guy has a high PSA, they come into a specialist. That'll be me. My
Mm-hmm.
job is to make sure it's not prostate cancer. Sometimes it can just simply be some infection, or
Mm-hmm.
say that 20-gram prostate that we talked about
Mm-hmm.
is now a 50 or a 70-gram prostate. A
Mm-hmm.
bigger prostate makes more PSA. So a
Okay.
guy
Uh-huh.
can actually have a higher PSA and not have prostate cancer. So
Mm-hmm.
PSA is not a specific number, but
Mm-hmm.
it's a good marker that you follow over time. Now,
Okay.
when you
Uh-huh.
screen, you need two things to happen with screening. You need
Mm-hmm.
the PSA, and
Mm-hmm.
you need a digital rectal exam. That's where you take the
Mm-hmm.
digit, you
Mm-hmm.
place it in the rectum, and you feel
Mm-hmm.
the prostate. God kind of set it up where the prostate was easy for us to get to.
Yeah.
You can go in there and check it.
Yeah.
So the thing about it is that, I joke some of my friends when I shake their hand, I was like, hey, I've checked that. So this
However, I need
finger
to
right
get you
here,
there. I need to get you there, right?
this finger right here.
Yeah, because listen, Dr. Fossil, listen. So, because what they're feeling for, right, is the size, and you guys can feel from the size because you just done so many, and you know when the size is large or when it's too small. I mean, or
Yeah,
right.
you gain a gestalt for it. Now the thing about it
What
is
is good
that
stuff, Dr. Fossil? Dr. Fossil.
you get a
What is
feel
good stuff?
for it where over time
Uh-huh.
you become more and more confident,
Uh-huh.
where
Uh-huh.
you don't actually have to have, something that is hardcore. It's just, I got a feeling that this is this. All right. So it's
Uh-huh.
kind of a gestalt
Uh-huh.
that you get over time. But the thing is
Uh-huh.
that I always describe it like this. They say, well, what are you feeling for?
Mm-hmm.
If you make a fist,
Mm-hmm.
this right here is the thenar muscle. All
Mm-hmm.
right. And you make a fist and you make it tight. That's what the prostate should feel like. If you come
Mm.
over here and you feel the knuckle, that would
Uh-huh.
be a nodule on the prostate. All right. If the
Ah.
prostate, you make your fist soft, you're not squeezing hard. Now I
Uh-huh.
can push into it. That's a prostate that's possibly got some infection in it because it's too soft or it's tender when I push on it.
So it
So
should be hard and firm.
it should be firm,
Uh-huh.
just like
Uh-huh.
this.
Uh-huh.
But even the term firm can mean other things in medicine when you're describing a
Uh-huh.
prostate.
Uh-huh. But how
But
do you know about the size from that? Because
well,
how it's feeling is going to also tell you the size.
over time, because you've checked enough of them, you can
Mm-hmm.
feel a prostate and say that's enlarged or that's
Okay.
normal size. That goes back to that gestalt.
Uh-huh.
So I
That
know what it
gestalt, and gestalt means, just
it's
tell us what
that
it means so we'll know,
it,
because you don't
it,
like to use it.
it's that feeling of knowing what something is without
Uh-huh.
actually having to see it.
Uh-huh.
I just got a feeling for it.
Uh-huh.
I'm just trying to use some layman terms.
Yeah,
So
yeah, no, no, understood. Uh-huh.
the thing is that you can feel, once you felt enough normal
Mm-hmm.
prostates, you
Mm-hmm.
immediately know something is abnormal, because I know what normal feels like. So
Understood.
like when I have medical students or residents that are training under me,
Mm-hmm.
my whole thing is you need to learn what normal is. All
Uh-huh.
right.
Uh-huh.
So you go in here, you do the exam. Your thing is learn what normal is.
Mm-hmm.
So if you decide to go into family practice or
Mm-hmm.
something like that, internal medicine, a guy comes in, you do a prostate exam. I'm not looking for you to diagnose prostate cancer, but I
Mm-hmm.
do expect for you to know what normal is. So you can say, your prostate's not normal, you're going
Yeah.
to see a urologist. So you send them to
Ah.
me then, and then I
Ah.
figure it out.
Ah.
But you need to
Ah.
know what normal is.
Yeah, I like that. You're a really good instructor for medicine. I just got to get you down to the layman people though. But you did that. That's really good. No, but I like the way that you give. First of all, you gave us a new word. Gestalk. Is that what you said?
Gestalt.
How do you spell it? How do you spell it? How do you
Girl,
spell? You don't know? Okay, don't worry. Don't worry.
uh,
I'm gonna look it up and I'm gonna let you guys know how to
yeah, I
spell it.
don't
So
want to
we'll
guess,
learn our
man.
new words.
I know I'll be off on that.
Okay, yeah, no, okay, no, absolutely, no, absolutely. Okay, so Dr. Fussell, so in closing, and I know that we didn't talk about cancers and the BPH, and we gonna get him back on this. We got sleep outside the house. Now, Dr. Fussell is very, very smart, but I call him the Black Hunter because he hunts. And this is an Afro descendant podcast with Afro descendants, right? Who I'm trying to educate more, right? And so Dr. Fossil is our Afro descendant hunter, and he hunts. That's what you do for fun, right? That's what you
Yeah,
do.
that's my pastime.
Yeah,
I'm a country boy,
yeah,
growing
yeah,
up down in South Georgia and
yeah,
being on the farm, I have a
yeah,
small farm. So,
yeah.
we
Wow,
we like to
wow.
hunt and fish, and I got a
Yeah,
couple of horses. So,
yeah,
and my
yeah,
fun time is, out at the back of the barn, chilling out.
yeah.
So, even though, I play this role over here,
Yeah.
once all this comes off, I'm just a country boy.
Yeah. Hey, listen. So that ain't going to homecoming. So I'll meet you on that side of fun, the homecoming side, because although I'm from Mississippi, I'm not the farm here. I don't like animals in that way. So I'll meet you. I'll be running from them. I'll meet you at the homecoming side of the fun. Like for me, it's music. So it's no music, no life, right? For me. So, I always say, don't worry about it. Something happens, that machine, you got to turn off, put the headphones. If I don't respond to the music, I'm out. Turn the machine off. That's literally what I tell my family, because for me, it's music, it's concerts. I have literally gone to 4 concerts in the last month. I like love music, right? And got like 3 or 4 this month, right? So that's my vice. That's how I'm so much of a nerd, and people don't see that because I'm so outgoing, because I try to be relatable to people. Because as you know, because you are like you. Where you at up here, Dr. Fossil? We don't know what you're talking about. Come on back down to us layman people, right? But I really appreciate you coming on to just start this men series off, because we have I'm trying to have all male doctors, right? So it can be relatable for men. So that's why we have to have you back and kind of talk about some details about the prostate and the cancer and just some other things, because it's the prostate health and sex series, the things that you never thought about as you age, right? As I'm in this age group, that certain things happen for women, but they also happen for men, and men kind of go be people don't see it happening, if you will, right? And so and then a lot of it is because of their ego, they're not going to address problems and issues and concerns that they're having. So that's the purpose of the podcast, to do that. So tell Dr. Falls, now, are you on social media? You telling your age when you say this answer. Are you on?
Yeah, actually, we're getting our social media out there. You can look me up under Body Evolution, MD is
Uh-huh.
what we're under. My
Uh-huh.
website, we're doing some work on that.
Okay.
There are other things that we can talk about on the next time I come back.
Uh-huh. Uh-huh.
Because I do a lot of work with penile enlargement. So a guy
Yeah.
says he wants to be bigger. You
Yeah.
can look me up under Penuma, Penuma
Panuma.
Penuma, Penuma.com.
Uh-huh.
I'm one of the pneuma surgeons. There are only about 11 across the country.
Uh-huh.
So the thing is that, I offer FDA approved implant for guys that want a bigger phallus. This is
Mm.
not for erectile dysfunction. It's just, hey,
The
I think
guys
it's
want a bigger phallus. What's a phallus,
bigger
doctor?
penis.
Okay.
I
Uh-huh.
want my
Uh-huh.
penis bigger. I can
Uh-huh.
do that. And it's
Uh-huh.
FDA approved now,
Okay.
so that's something else that, we offer. So I have guys that fly in, you know, the guys want to keep it private. So they fly in, we put them up at my private ranch. We take them to my private operating room. We do their surgery. You know, everything's completely private and we take care of them. And now nobody knows you came down because you want your penis bigger.
Yeah.
But when they leave out, they got a much bigger penis. And some of the guys are truly impressive. I mean, when you start talking about when you get erection and you can't get your thumb and forefinger around the base of your penis, you know, that's some increase in size.
Wow. Now I don't even know if women gonna be wanting all that, but okay, that's a whole nother conversation. That's a whole nother topic. But okay. But now, so what do you do? So you do that for penile enlargement. So, but what do you do for because you say erection comes in three things, right? The blood flow, the nerves, and the desire, right? So how do you? And you said the desire is part of the hormone, right? So what do you do for that part, the desire? So because they can have a large penis, but still not have the desire of their hormone. Like, what do you do for that? Because I know you do something. I'm just asking you so you can tell the people, right?
Yeah, usually when we do that, first of all, you know, we're gonna check your labs because we need your baseline labs to figure out exactly what's the problem. Remember, I talked about this axis where the brain communicates with the testicles.
Yes.
So we need to make sure the axis is actually working. And then we can figure out, is it a primary problem, the testicles, or is it a secondary problem?
He's pointing down to the primary point.
Coming from the brain.
Yeah.
You know, so we figure that out. Once we realize what it is, then we say, okay, are you truly a candidate for testosterone replacement? You know, and then we go from there.
Okay. So, but if the testosterone levels are low, you also offer the pellets, right?
Right. You
can because I'm a big pellet proponent, right? I get the pellets, and I want men to get, I want some men to get some pellets, right? So, just talk about the pellets real quick, and I know you have to go.
Well, the thing is that when we start talking about testosterone replacement, there are a lot of different ways to replace testosterone. You can do anything from a nasal spray to injection therapy to actually doing pellets, things of that sort. Now,
patches, patches
also, you know, or things, gels. You know, so you got gels, nasal spray, patches, you know, injection therapy. Usually if a guy comes in, I'm going to be talking about getting him going because I want to get his levels back up. We'll start off with injection therapy. But if you want something that's more therapeutic on a higher level that stays there, now you're talking about pellets. So the thing is that first you got to meet the patient where they are.
Yeah.
You got to get a complete diagnosis of what's really going on. And once you document what's going on, because testosterone has this what we call diurnal measurement, where it's higher in the morning, lower in the evening. You know, so you check.
It's higher in the morning, lower in the evening. Note to self. Okay, go ahead.
Right. So you check. That's part of why guys used to be going hard on all the time. All right. So the thing is that you know you want to get morning labs and make sure you truly know what's going on, and then from there you say, do you really need replacement? You know, so that's how we work that up.
Okay, I like that you two do a detailed analysis of the individual, right? Because everybody is different to decide what they need. See, that's why I told you I only get good people. Like I already told you, like I told you, this whole thing is personal for me with this podcast. So Dr. Fussell, just even the way that you decide on what a man needs, it's very important for me to help people to understand, like, this is where you need to go. So because I'm on Dr. Fussell's time now. So he already told me what time he had to, and our time's up. So Dr. Fussell, just one more time, let everybody know where you're located, where they can come to see you, and and always it'll be on my website how to get in contact with Dr. Fussell, and a link as soon as we get a link. But we'll have his information on there under our referral, so you can always go to blackpink.org, right? But Dr. Fussell, you tell them again, because Dr. Fussell, this has really, 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 really been good, because I learned, like, a lot of things I know, but I too always learn something, because I'm a forever learner, right? So I also learned something. So I've learned a lot, right, to bring the guys in the conversation, right? So you're probably going to have some men just kind of saying, "Ooh, let me call Dr. Fussell," because we know how old we are, right? But let the people know that I really have really and truly enjoyed this. And people don't know, but we're doing this in like midday. So this has made the rest of my day. I've learned a lot, especially in those peaks. Okay, yeah. But tell the people.
You're funny.
How to reach you and where you're located.
Okay, once again, I'm located in Warner Robins, Georgia, which is south of Atlanta. It's adjacent to Macon, Georgia, so we're middle Georgia. It's the Urological Health Center.
Uh-huh.
The thing is that that's the urology side of the practice.
Uh-huh.
My cosmetic side of the practice is Body Evolution, MD. So we're getting some of our websites and stuff like that up and going. So if you just want to call our office, it's 478-333-6961, to directly contact us. Otherwise, you'll be able to just go to my website, which we're putting some finishing touches on a new website.
Okay. So you said the number is 478-333-6961.
That's
Correct?
correct.
Okay.
That's the office.
So that's how we call the office and get appointment. Now he told you got a private ranch. Now that ranch part, because he's a Black hunter. So he has a private ranch. He has his own surgical center, correct?
Correct.
I'm glad I know you. Like, I know you're not like I know somebody who knows somebody. You're like, I know you. Like, I'm so glad that I know you, right? Booker T brought us together. Like, I absolutely, and I have some more people on from school, right? So I'm so excited about that, because you already know what people say about HBCU. So this is a HBCU graduate. I'm so excited about that you're on here. You're smart as a whip. You're so smart. I got to bring you down so you can help us be with the layman people. But Dr. Fussell, that's a good thing. Thank you so much for your time. Thank you for continuously saying, let me see. I kept bothering him, y'all. You persevere, right? I kept bothering him. I was like, let me get this girl on here because she bothers me. So let me just go do her podcast. So thank you for just coming on today and doing the podcast. And we're going to have you back, Dr. Fussell, and we're going to have some questions, and the people are going to be coming to you. Let them know that Blackpink's, you heard Dr. Fussell on Blackpink. And what you do is your business, because you got all this private stuff, but I'm just saying, you can let me know I win this on him. So
well,
thank you.
This has been a joy. I appreciate it, and thank you for inviting me. I can't believe we've been talking for
I told you.
an hour.
I told you.
Know?
I told you.
So,
I told you.
Yeah, I do have to go because I got the patients waiting.
Okay, thank you so much. Absolutely. You have a good day.
All right.
Okay, bye-bye. Oh my gosh. This has been so very good. Listen, Dr. Fussell has been so good today, but before we get into the recap with Dr. Fussell, I want to take the time to talk about our featured artist today. The featured artist today is, if you know me, then you know the story. So I decided to do this because when things happen to you, you like to try to move on from things. And I love music, you know that. Hence is why I have the soul notes on here. I'm here to help you breathe. And our featured artist today is Avery Sunshine. Avery Sunshine is actually from Atlanta, and she was the minister of music at a really big mega church here in Atlanta. But she is also one of those artists who can really sing. She plays several instruments. She can really, really sing. Y'all notice that I don't even talk about people who can't sing and they're really singing. I don't talk about people who use voiceovers and sound like a train, or maybe I shouldn't have said a train because I'm getting beat up, but you know what I mean. So the album today that I'm featuring is Avery Sunshine 2064. And the particular song that I chose from this album is called Jump. And the song is basically talking about, go ahead and do the things that you need to do. Stop being sitting still, stop being stagnant. And I chose this song because even for your health, you need to stop being stagnant and stop doing things that you don't need to do and do the things you need to do. Jump and get it done. Avery Sunshine is Avery Sunshine on all of her social media. She's Avery Sunshine, Sunshine. And I'm going to give her a shameless plug. She's going to be in concert here this weekend at Mabel House with some other person if you're in the Atlanta area. So you will not be disappointed if you go to her concerts. Check her out, check her music out if you don't know her. She's Avery Sunshine. She has at least 3 or 4 albums out. I think I have all of them. My first one is probably her first album, Avery, titled Avery Sunshine. Then she has a Sunroom, and she has this 2064. So we're waiting on some new music from you, Avery. And but check out Avery Sunshine, and if you see her, let her know that you heard about her here on the Rhythm Notes of Health podcast. So let me just get into this little review of today's podcast with our men series. Oh my gosh, this was so good. And I told Dr. Fussell before he came on, like he didn't have a clue what the format was going to be, how long we're going to be on here. But I said, hey, listen, it's going to go fast. You're going to enjoy it. And he's like, well, how do I talk about this and not talk about this? And I was like, don't worry. I'm going to give you the questions. You just answer them. It won't be anything that you don't know, because my goal is to make sure that the people who listen to the podcast is clear on what we're talking about. Because if we talk over your head, it's going to be just like you're talking to the doctors, right? So this men series is going to be really good. As you see, I favor some HBCU graduates, and particularly if you Booker T kids, which you is Tuskegee. And so with Dr. Fussell told us a few things. Number one, with your prostate, he told us that you should be getting a screenings at 50. That's the new guidelines. But if you have history of prostate, and now we know our breast cancer, then you need to start your screening at an earlier age, around 35, to be getting your PSA done. He also told us that the prostate is with 2 exams: your blood, which is done with that PSA, which is a prostate specific antigen that looks for something in the blood, an indicator. And he told us that the other screening was the finger screening, and that which if you're able to see this on the YouTube that we're on blackpink.org, you know that he put his finger up and said, hey, this finger checks prostate. And he specifically told us how they were able to feel and know the size of the prostate, whether the prostate was normal or abnormal. He also told us in understanding in numbers and markers that normal prostate is anything less than 4, right? And he said that if you're at a 3, this is PSA numbers, at 35, then you needed to be watched more. You may need to do a biopsy, but you need to definitely watch your prostate, right? We also talk about size of prostate and how it grows, but specifically, we talked about men has 3 things for erection: blood flow, nerves, and desire. And desire comes with the hormones. And then men too have hormone depletions. And then they also have hot flashes. They feel tired. Their sex drive goes down. And all these things is because of their prostate. It works in conjunction with their prostate. We also, and I don't want to tell you about the whole show, because I'm going to say this one more thing, but you got to make sure that if you're at the end, hopefully you saw the show or you heard the show. So I'm giving you a recap. But if not, if you missed something, go listen to it again. But he also told us what the prostate do, the importance of the prostate, why you can live without the prostate, although you will not be able to have kids in the direction from the penis, but there will be other ways to, I guess, get sperm, right? So listen to the show. Send me your questions at info at blackpink.org. And if I can't answer them, I'll get them answered from one of our doctors here. So this men series is going to be wonderful. Dr. Fussell also gave you his information to get in contact with him, but you can always go to blackpink.org. His information will be there. And you can reach us at blackpink.org. Make sure that you're downloading the podcast, and make sure that you are so that when new shows drop, you can automatically get them. So make sure you follow us on all of our podcast streaming platform. I have talked way too long. My music has gone off, and you know that doesn't happen, but I'm really excited about this men series and this podcast. So until the next time, I will see you later. This is Kai Ianta. I'm the soul of public health. I hope you've enjoyed today's show as much as I have. Bye.